Good evening, everyone, and welcome to today's wonderful evening with Dr. Murali Bharadwaj. NEETPG 2024 is going to be within another 30 to 32 days, right? 2-3 days को count मत करो. 1 month लगाओ, solid 1 month का time आ गया. And now the time that every day we have one NEETPG mock test, full-scale mock test discussion. Please go to the Learnograph. You have all 200 questions PDF. Try to solve the questions before coming to discussion. Sit with 2-3 friends. Go to Learnograph. Just by paying $500, you can download a ebook PDF. You can share that PDF to another 10-15 of your friends freely, no problem. But all of you sit, solve the paper, come to the discussion, and get better every day. That is what we need to pray to God. Oh, wonderful God, you created me to become a great cardiologist, nephrologist, neurologist, neurosurgeon, physicians, ultimately to unravel that mystic diagnosis and bring a relief to the patient. So you're born with a purpose. You're the creation who is the purpose of the God. That's the reason what you need to do, doctor. Every day, don't feel anxiety. क्या होगा, मुझे याद आएगा या नहीं आएगा? No need of thinking that. Everything will automatically, you will remember. Only thing what you can do is karma. Do the karma without expecting any phalitam, falapeksha के बिना कर्मा करते जाओ और automatically seat आएगा. There are hardly 1130 topics, doctor. So we launched a set of books which are the mind maps of quick revision, 150 mind maps for each subject. Already microbiology, biochemistry, and ophthalmology we have uploaded into the learnograph.com ebooks. Try to download. There you have the gist of all the mind maps, right? And that we are going to release all the 19 subjects shortly. So try to do a revision. 100% strike rate will be there from this ebook PDFs of mind map revision of all the 19 subjects in a very crisp and cryptic way. Okay, so with that preamble, let's make the great beginning. Very nice to see हमारे पंजाब का किशोर Ravinder Singh, and Ravinder Singh, Anita, everybody, I hope that you will become topper and send me a laddu on the WhatsApp. I'm eagerly waiting for that moment. So, doctor, let's make the great beginning. Yes. So, NEETPG 2024 may at least 50 to 60 MCQs, expect them to be image-based questions. All right. Now, a 74-year-old man with dysuria has undergone a prostate biopsy. So this is called the Gleason pattern 4. That is poorly formed, fused, cribriform glands would suggest aggressive behavior compared to the lower patterns. So this is Gleason 4 is what you need to remember. Now you have one indirect inguinal hernia, one direct inguinal hernia with the inferior epigastric vessel in between the two. So this is characteristic of Romberg's hernia or pantaloons hernia, which involves both direct and indirect hernias on same side. So it is a pantaloons hernia, or you call Romberg's hernia, is what you have to basically remember. Now, a 72-year-old with anemia, with bone pains, high ESR, peripheral smear, what do you see here? Rulex formation. So whenever there is any hyperviscosity in multiple myeloma, which is due to hypergamma globulinemia, what do you get, doctor? You get the Rulex formation. So this is a classical example of multiple myeloma is what you need to remember. Can online students can punch is the voice loud and clear for all of you, doctor? Let me also put one broadcast on my phone also. Yeah, can you please punch is the voice loud and clear for all of you? Good. Thank you, Ravinder, for the feedback. Good. Thank you, Ravinder. Okay. Very good. Now I can see. Yes. Now, a 56-year-old former coal miner undergoes a lymph node biopsy. So, this black pigmentation in the lymph node biopsy is characteristic feature of anthracosis, which is common in case of cold workers. Coal workers is what you need to remember. So what do you see here, doctor? It is the circumvallate papillae. It is a cut section of circumvallate papillae. The taste buds, the papillae, they're all favorite topics, doctor. They're very, very favorite topics of the examiner. So the glossopharyngeal nerve, the cranial nerve 9 is primarily responsible for carrying the taste sensations from the circumvallate papillae, which are located on the posterior third of the tongue, is what you need to remember. A 50-year-old undergoes submandibular excision for chronic sialadenitis. During the procedure, the surgeon ligates the submandibular salivary gland duct. What is it called? Morton's duct. Right? So, Morton's duct. So, when Morton's duct is ligated, what is the nerve which is very close to that, which is also injured? It is the lingual nerve. Thus, reason there is a tingling sensation and numbness in the anterior 2/3 of the tongue, along with altered taste whenever the structure B is the Morton's duct. Structure A is typically the lingual nerve, is what you need to appreciate. 64-year-old with fatigue, easy browsing, abnormal bleeding. What do you see? Fatty bony marrow. Fatty bone marrow is characteristic feature of aplastic anemia whenever there is pancytopenia. 52-year-old with fatigue and weakness has bone marrow biopsy. There is also chromosome 5 deletion. So what do you see here? Myelodysplastic syndrome, classically. So lenalidomide is the drug of choice in this given case, is what you need to remember. Right? Very good. Kaushik Das. Keep punching your answers. That is how we need to go forward. Now, 44-year-old patient presents with fever for 3 days, followed by subcutaneous bruising, small red spots on the abdomen. The lab test showed 25,000 platelet count. Right? So it is a case of after fever developing thrombocytopenia is idiopathic thrombocytopenic purpura. 44-year-old presents with a dark urine, severe fatigue. Flow cytometry is showing around 27% of the RBCs which are deficient in CD55 and CD59. So what is your diagnosis, doctor? Paroxysmal nocturnal hemoglobinuria. Very good. Kaushik Das, Ravinder, Lakshmi, Madhavi. Excellent. Keep punching your answers, doctor. That is the best way that you can do the revision, right? And also keep few comments that you studied, that you remember on this particular topic. So you should know. Everybody asked, what is most important thing to get the seat in NEETPG in post-graduation? Is it the video library? Is it the mobile app? Is it the question bank? Is it the mock test? Is it the face-to-face classes? Is it the national teachers? Is it a great, what is that called? Dream team? Everything is bullshit. The most important thing you need is one good classmate, one good benchmate, tablemate, roommate who gives you company, who shares your dream, equally passionate with you, who studies with you every day. So that is the role of a teacher. So हम सब मिलेंगे, हम क्वेश्चन पेपर को रोज सॉल्व करेंगे. At least 50 to 100 questions I'll definitely discuss. But you need to get that inspiration to finish all the 200 questions. That is very important. All right, doctor. So you should promise me, next 30 days, you need to solve 30 full-scale grand tests and go to the exam. Already 19 grand tests. This is the 19th grand test, right? Like IPL matches. So every day you should improve. There are 200 mind maps given. Each mind map has around 10 points. That means around 2000 high yield points you get in every mock test. 50 mock test means 50 into 2000, almost 1 lakh high yield facts. Definitely after you take out repetition, 50,000 high yield facts are covered in this 50 full scale grand test. So today only go to learnograph.com, download, and then start solving the paper. Don't wait for a great time to arrive where you can start, right? So, doctor. So typically, CD55, CD59, they protect the RBCs from a complement-mediated destruction. So the moment they are deficient, when the RBC is passing through the blood, the complement will try to destroy it, more so in the night. Why? Complement-mediated destruction requires an acidic environment. So in the night, when your respiratory rate is less, then you develop a respiratory acidosis, because carbon dioxide you cannot breathe out while sleeping. So that respiratory acidosis in the night time will provoke the complement to go and attack the CD55, CD59 deficient RBCs. That's the reason hemoglobinuria is more in the night. That's the reason it is called paroxysmal nocturnal hemoglobinuria, is what you need to remember. A 34-year-old, general fatigue and lab tests indicative of anemia. A bone marrow biopsy show Prussian blue. What is the most likely diagnosis? It is called sideroblastic anemia. These are called sideroblasts, is what you need to remember. Right? Right. Obstructive sleep apnea will aggregate PNH. Possible. Because obstructive sleep apnea also state of hypercapnia. Hypercapnia lead to acidosis. Now, a radiologist interprets T2 weighted MRI of a young female patient with short stature, lack of pubertal growth. So what do you see here, doctor? You see streaky gonads, right? Very good. I'm so happy to see online students actively punching into the chat window. That is how the preparation should be. And if you do that, I'll get interest to discuss more number of questions actually. So, right now, a patient with history of streptococcal pharyngitis presents with cardiac symptoms. So, earlier case is a case of Turner's syndrome with streaky gonads, primary hypogonadism. XBO is the genotype. So, streptococcal pharyngitis with cardiac symptoms is basically rheumatic fever. And what you are seeing is Antishkov cells with the Ashkov's bodies in case of rheumatic fever is what you need to basically remember. Very good. Patient presents with a well-demarcated erythematous patches and blocks on the skin. Excellent. Kaushik, Ravinder, and many more who are all online. Keep punching the points that come to your mind. We are all in revision bhajan, right? Revision ka bhajan kar rahe hain hum sab. So, well-demarcated erythematous patches and blocks on the skin as what you can see here. So, histology is being shown to you. So, typically, this is called epidermotrophism. And you can see the lymphoid cells. So, it is a cutaneous lymphoma, which is called mycosis fungoides, is what you need to remember. A biopsy from a lymph node in a young adult shows on H&E staining. So what do you see here, doctor? Starry sky दिख रहा है, नक्षत्रों से हरा भरा अंतरिक्ष दिख रहा है. इसको कहते हैं Burkitt's lymphoma is what you need to remember. So starry sky marked by interspersed macrophages among dark blue malignant cells. That's the reason it gets that starry appearance, which is because of the Burkitt's lymphoma is what you need to remember. A biopsy from the terminal ileum in a patient, typically they show a positive staining for cyclin D1, CD5, CD20, CD43, but negative for CD23. And there is a T1114 translocation. After giving so many clues, you must be able to diagnose by now, right? So typically small monomorphic mitosis and the profile positive for cyclin D1, CD5, CD20, CD43, T1114, chromosomal translocation. All this is characteristic of mantle cell lymphoma. Kaushik, Ravinder, everyone, mantle cell lymphoma. So everything, anything about mantle cell lymphoma, I leave the literature for you. It's a very aggressive type of lymphoma. Patients present with ascites, pericardial effusions, shortness of breath, etc. A biopsy under high magnification. So what do you see here, doctor? Follicle large B-cell lymphoma. So the clear follicular cells is what you're able to see here. Composed of centroblasts. Under high magnification, these are called centroblasts, is what you need to remember. Centroblasts are the ones which are being shown to you. So that is called follicular large B-cell lymphoma, is what you need to remember. Now, a patient with a history of fever, sudden left flank pain, platelet count of 18,000, CT imaging, what does it show? Retroperitoneal hemorrhage is being shown to you. So fever with such a severe platelet dysfunction, low platelet count with retroperitoneal hemorrhage, you will think about severe dengue fever is what you need to remember. 35-year-old female with brownish streaks of hyperpigmentation. Typically, you can see hyperpigmentation here, here, here. And also on many other areas. A recent history of severe fever along with joint pains, malaria negative, dengue negative, typhoid negative. What is the possibility of such a severe break-bone fever? It's typically seen in the case of chikungunya fever. Lot of times, NEETPG में a नोज के ऊपर जो भी हाइपर पिगमेंटेशन है वो फेवरेट क्वेश्चन ऑफ द एग्जामिनर. दैट्स राइट रविंदर, चिक साइन. Excellent, excellent. Now, a kidney transplant patient presents with urinary frequency discomfort. Cystoscopy is being shown to you, right? So you see a yellowish block in the interior of the bladder on cystoscopy. And what are these called? Michaeli-Guttman bodies. Typically are the feature of bladder malakoplakia is what you need to remember. So it is an inflammatory condition with the accumulation of macrophages leading to soft plaque-like lesions in the mucosa. And any chronic bacterial infection, immunocompromised state like post-kidney transplant, typically patients can present with malakoplakia, Michaelis, Guttman bodies. They are the buzzwords. Tomorrow, same ditto MCQ, aega, paper out, but you need to recognize. You need to practice all the 50 full-scale grand tests with Dr. Murali Bharadwaj. Solve the paper, just not buying a package, but solve the paper, sit with your friends, share the PDF everywhere you can. And with all those online friends to whom you have freely shared, sit with them, solve the paper, and then get the best use of it. 35-year-old, hematuria, lower abdominal pain. He had history of swimming in freshwater lake. Urine analysis is showing parasitic eggs. Right, doctor? Parasitic eggs is what you are able to see. So there are calcifications in the bladder. Right? Yellow sandy patches with calcified cystosoma, hematobium eggs can be seen on the cystoscopy. So these are the cystosoma eggs in the urine, right? And can be visualized with a nucleopore filter after urine filtration. And polyps in urinary bladder. So this is the story of cystosoma, hematobium is what you need to remember. So there can be bladder wall thickening, dilatation of ureters, polyps of the urinary bladder. All of them are possible. Now, a 68-year-old presents with painless hematuria. Cystoscopy had been done because he has and with the transurethral biopsy has been done. So painless hematuria with the urothelial cells on histopathology with the transitional epithelium typically is urothelial carcinoma is the correct answer. So doctor, every ebook PDF has 200 MCQs typically containing at least 40 image-based questions and remaining all clinical vignette-based questions given to you as a PDF in the start of the ebook. So first to solve it, whatever be your level of preparation, solve it. Then go through the 200 mind maps. And in one mind map, I give everything. All the important essential points को एक map दे देता हूं मैं. And what you need to do, you need to solve it, you need to revise it there and then. Next time a similar question comes on the similar topic, you should be ready to crack it. That's how you need to improve with every high yield, with every NEETPG mock test of this 50 mock tests. One day, आपका number आएगा. Right, doctor? This is the 19th mock test and discussion. A patient presents with the appearance of the tonsils which have been shown to you. What do you see, doctor? Yellow tonsils, yellow streaks, highly characteristic of Tangier's disease. Tangier, where there's a cholesterol accumulation in the peritonsillar area, is what you need to remember. 36-year-old with a family history of hepatosis presents with the caudate nucleus atrophy with the dilated ventricles, which is characteristic of Huntington's chorea, is what you need to remember. But to call a chorea as Huntington, what is needed? Family history of choriohepatosis need to be there, is what you should remember. 30-year-old laboratory technician. Yaad rakhna, doctor. One label A is rotenone, complex 1 NADH, dehydrogenase inhibitor. Malonate is B, complex 2 succinate dehydrogenase inhibitor. Antimycin A, which is label C, which is the complex 3 inhibitor. Label D is cyanide. Cyanide is cytochrome C, complex C. 4 is cytochrome C, and complex 5 is ATP synthase, and it is the oligomycin, which is the inhibitor of ATP synthase. You need to be very sure, doctor. One MCQ, sure shot in the tomorrow's NEETPG on the electron transport chain inhibitors. The patient presents with discrete brown to skin colored keratotic follicular papules with central keratinous plaques localized on the elbows, which is very characteristic of phrinoderma, which can occur because of the potential nutritional deficiencies. Phrinoderma. Vitamin A deficiency also can cause phrinoderma, is what you need to remember. A patient has a scaly skin. What you're able to see? Scaly skin. Red itchy patches on the trunk. So this is called ichthyosis vulgaris with atopic eczema, is the diagnosis. I leave the literature for you to do the revision, doctor. A patient present with persistent scaling and erythema of the hands. So dermoscopy and histopathology. What do you see? Spongiosis and parakeratosis. This is called chronic hand and foot eczema, is what you have to remember. 18-year-old female presents with small rough bumps on her arms and back, as what you can see here, on the arms and on the back. So this has got a sandpaper-like appearance. So this is called keratosis pilaris, right? The bumps are often described as chicken skin and are caused by the building up of the keratin, which blocks the hair follicles, is what you have to appreciate. A patient has a non-itchy erythematous ring-shaped lesion on the forearm. It is granuloma annulae. How do you distinguish this from tinea corporis, which is called ringworm? There it is itchy and scaly. Why not psoriasis? Psoriasis is thicker and scaly plaques with eczema, which is also itchy, right? So that's how you boil down the diagnosis to granuloma annulare, is what you need to remember. A bone marrow aspiration shows the following lesion: tightly clustered eosinophilic central cells with centralized nuclei forming a nodular structure in the bone marrow, which is called epithelioid cell granuloma, is a granuloma that has got epithelioid cells. Whenever there is a chronic inflammation, infection, or any foreign body, this kind of epithelioid granuloma typically is formed. A patient presents with the features shown on the CT. So what do you see on the CT? Cavitating lesion. Cavitating lesion. And histopathology shows geographic necrosis with a serpiginous border, it is called as. And a central necrotic zone surrounded by mixture of acute and chronic inflammatory cells, palisading histiocytes, which is very characteristic features of Wegener's granuloma, which is called granulomatosis with polyangiitis. If there is no granuloma, it is called microscopic polyangiitis. If there is granuloma, then you call Wegener's granulomatosis is what you need to remember. A nurse is disposing biomedical waste in the bag which is being shown to you. Right? So, typically, what is the type of waste that is disposed in this bag? It is the infectious blood dressing. Infectious blood dressing which is disposed in the yellow bag is what you need to remember. Right? Now, red bag, yellow bag, black bag, all this biomedical waste disposal. One of the favorite questions. What is the key differentiating feature of the granular type of trichophyton rubrum in this culture? Lot of microconidia and occasionally macroconidia is the characteristic feature of trichophyton rubrum. A patient presents with ring-like patches, right? Flocks, scaly flocks on the buttocks which are intensely itchy. So, numerous microconidia are being found. So, that is characteristic of, what is it an important feature of? So, you need to remember, it is typically Tinea corporis, which is caused by Tinea mentagrophytes, is what you should remember. So that brings us to the end of the image-based questions, doctor. Let us quickly crack the simple questions. Perineal artery is a branch of the internal pudendal artery which courses along with the pudendal nerve. In this 32-year-old male with a laceration in the perineum after a bicycling accident. 35-year-old woman presenting with clicking and pain in the jaw during chewing and limited mandibular motion is indicative of temporomandibular joint dysfunction. The facial artery gives off all its branches that supply the submandibular gland. The superior thyroid artery supplies the structures in the neck, but it is not the submandibular gland. Submandibular gland, facial artery, you need to be careful about. Progressively dry mouth, difficulty to swallow, loss of the taste, they're all symptomatic of Sjogren's syndrome, where there is a lymphocytic destruction of the salivary glands leading to xerostomia. Exocrine glands are affected. All right, doctor. Now, symptoms of inability to close the eye and asymmetry of the mouth are characteristic of facial nerve palsy. Facial nerve nucleus, where is it located, doctor? Third, fourth, midbrain, 5, 6, 7, pons, 8, 9, 10. Everything is in the medulla. Please don't forget, one of the favorite questions. Facial nerve nucleus is located in the pons. Once more, brainstem nuclei, you need to study, doctor. The right ovarian vein drains into the inferior vena cava. Left ovarian vein drains into left renal vein, not into the vena cava. That is the difference between the two. The right ovarian artery, left ovarian artery, both of them arise from abdominal aorta is what you have to basically remember. Now, doctor. Alkaline phosphatase in the semen primarily originates from the prostatic gland. It is important for the liquefaction of the semen. The bulbourethral glands primarily produce pre-ejaculate fluid, not alkaline phosphatase. So, alkaline phosphatase source is coming from prostatic gland. The ureter, it is not one specific artery which provide the blood supply. Renal, gonadal, common iliac, internal iliac, all of them provide the branches to the ureter is what you need to remember. The lateral femoral cutaneous nerve, it is the one which provides the cutaneous sensation to the lateral thigh. It originates from L2 and L3. It is called meralgia peristhetica, is what you need to remember. The recurrent laryngeal nerve is the one which is very close to thyroid. That's the reason it is commonly at risk of developing thyroid surgery. Standard questions, these are all. The vagus nerve is located within the carotid sheath, alongside of the internal carotid and internal jugular. Any severing of the vagus nerve can lead to vocal cord paralysis and many other parasympathetic dysfunctions. One of the largest parasympathetic supply going to our gut comes from the vagus is what you need to remember. The accessory nerve innervates both sternocleidomastoid and trapezius. Masseter weakness is trigeminal involvement. So you should know the nerve supply of all these important cranial nerves, doctor. Spirometry can measure the volumes that are exhaled or inhaled directly. So, functional residual capacity includes the volume of air remaining in the lung after normal exhalation, which cannot be measured directly by the spirometry. Residual volume cannot be measured by spirometry. Total lung capacity include all lung volume. Some of them include residual volume. That's the reason spirometry cannot be able to calculate the total lung capacity also. Right? Physiological dead space cannot be measured by spirometry. So, one question every time in NEETPG comes from this very important area, doctor. Right? Good. Oxytocin hormone is saying, happy birthday. No, I'm born on June 6th. Right? June 6th is a strong Gemini with two heads. Two things to do. Since morning, I am doing admissions, OPD, home visits, elderly, etc. Evening, I am your teacher. I am a student like you. So I'm a typical Gemini, June 6th born. Definitely, I'll wait for the day to receive a happy birthday from all of you. Right? Good. So, doctor, 45-year-old man, pulmonary function test, as we already discussed, FRC cannot be measured. Where is the airway resistance is highest? In the medium-sized bronchi. They have a smaller diameter compared to trachea and largest bronchi. So, why not medium size? Why not smallest bronchi? Smallest bronchi have smallest diameter. Their large number in parallel reduces the overall resistance. So, Large bronchi, smallest bronchi, both of them have typically less resistance. Medium-sized bronchi always have highest resistance is what you need to remember. ABG shows 7.32 pH, PaCO2 50. So pH of 7.32 is acidosis. Elevated PaCO2 means respiratory cause. Bicarb of 24 is normal range, ruling out metabolic compensation. So that is the reason answer is pure respiratory acidosis, not at the compensated. Now, para-aminohypurate is efficiently secreted by the renal tubule until its maximum transport maximum. So, at plasma pH concentration below transport maximum, what is correct? At plasma concentration below the transport maximum, nearly all the PaH is secreted, leaving very little or no PaH in the renal vein is what you need to remember. PaH is one substance which is not reabsorbed, but it is completely secreted by the renal tubule until its transport maximum is reached, is what you need to remember. Now, 5-year-old boy swallows a bottle of aspirin. So salicylate, aspirin is amino salicylic acid. Salicylate is a weak acid. If you do alkalinization of the urine, increasing the pH of the urine, it favors the conversion of the salicylic acid into its deprotonated form. And the deprotonated form is more soluble in water and is less likely to be reabsorbed from the renal tubules, is what you need to basically remember. Now, a patient with symptoms of vitamin B12 deficiency. Where is the intrinsic factor produced, doctor? It is produced by the parietal cells located in the gastric fundus, is what you need to remember. Gastric antrum primarily contain G cells that secrete the gastrin but not intrinsic factor, is what you need to remember. Both cholecystokinin and gastrin, they share a similar structure, particularly the 5 identical C-terminal amino acids. And because of this structural similarity, they have some overlapping biological functions. From where is CCK released, doctor? It is from the I cells in the duodenum, whereas the gastrin is released by the G cells in the stomach, is what you need to remember. Now, if there is a hypoparathyroidism, it will typically cause hypocalcemia, hyperphosphatemia, and after thyroid surgery, it is very common. So that is what you need to basically remember. So, 38-year-old with galactorrhea is found to have prolactinoma. Physician treats with bromocriptine. So, how does bromocriptine act? Prolactin secretion is mainly inhibited by dopamine. Bromocriptine is a dopamine agonist. So that more dopamine will cause less prolactin. That is what you need in prolactinoma, is what you need to remember. So once more, I leave the literature for you quickly. Prolactinoma, how do you treat? What is the mechanism of action? Blah, blah, blah. In one single mind map, you get everything, doctor. Be ready. Good, Kaushik. Keep going. That's how you need to do the revision. A patient diagnosed with pheochromocytoma with severe hypertension and tachycardia. What will you give? Just don't give beta blocker alone. You need to give a non-selective alpha blocker, is used to first control BP by preventing alpha-adrenergic alpha-1 receptors lead to vasoconstriction. All the catecholamines of pheochromocytoma, when they act on the alpha-1 receptor, that lead to the development of sudden rise of the BP. So first give phentolamine, which is non-selective alpha blocker, control the BP, then give propranolol, which is a non-selective beta blocker, to control the tachycardia and other cardiac symptoms, is what you need to remember. 30-year-old women, antral lobe of the pituitary has been removed. Removal of the antral pituitary results in loss of FSH and LH, leading to absence of the menses, is what you need to remember. A higher Km indicates lower affinity for the substrate. So what is Km? Km is the substrate concentration at which the reaction rate is half of the Vmax, is what you have to remember. A competitive inhibitor affects the Km but not Vmax. Non-competitive inhibitor affects the Vmax but not the Km. Every NEETPG में एक क्वेश्चन पक्का पक्का मिल जाएगा. It is a definitive seat. Just like Rai Bareli for Congress, Varanasi for BJP, उतना पक्का वाला topic है. So now, doctor, 32-year-old, regularly uses IV drugs. So you are given description of a process. And what is that description? It involves running a protein sample on an electrophoretic gel, transferring it to a filter, and using labeled antibodies to detection. It is called ELISA, enzyme-linked immunosorbent assay. 42-year-old female presents to the physician with lethargy, cold intolerance. So, phenylalanine is an essential amino acid that must be obtained from the diet. Arginine, glycine are non-essential amino acids. Histidine is mentioned in the options, is also an amino acid, but the symptoms described are more in favor of phenylalanine deficiency. So now, doctor, the most common cause of congenital adrenal hyperplasia क्या होता है? 21 alpha hydroxylase deficiency. It will cause a decreased cortisol and aldosterone synthesis, leading to low cortisol, lead to hypotension, low aldosterone lead to salt losing and volume losing, leading to hypovolemia. And all that excess androgen in 21 alpha hydroxylase lead to ambiguous genitalia in genetic females, is what you need to remember. 11 beta hydroxylase deficiency also causes ambiguous genitalia, but it leads to hypertension because of increased 11 deoxycorticosterone levels. 17 alpha hydroxylase deficiency lead to hypertension because it's excess aldosterone production, but under virilization in a genetic male because of decreased testosterone production. A researcher studying the peristaltic contractions of the small intestine. So whenever there's a smooth muscle contraction, calcium colmogulin complex activates the myosin light chain kinase. Myosin light chain kinase. It is a kinase. Kinase means it phosphorylates. Phosphorylates the myosin light chains, which is needed for the myosin to interact with the actin to lead to contraction. And dephosphorylation of these myosin light chains would inhibit contraction, is what you need to remember. Now, M3 muscarinic receptors, they activate phospholipase C upon stimulation. Phospholipase C cleaves the membrane-bound phospholipids, producing inositol triphosphate and diacylglycerol. Inositol triphosphate increases the intracellular calcium by releasing the calcium from the endoplasmic reticulum, is what you need to remember. Whenever lacto-ovo vegetarian diet, that consumes dairy and eggs for 6 months. So typically macrocytic anemia, MCV is increased. Any vegetarian diet, especially low in vitamin B12 and folate, can lead to macrocytic anemia, is what you need to remember. Now, aspirin inhibits cyclooxygenase. It decreases prostaglandins, thromboxanes. But all that will shift arachidonic acid metabolism towards lipoxygenase pathway, which lead to increased leukotrienes. That's the reason sometimes aspirin can predispose to asthma because of this excess leukotriene B4 production is what you need to remember. Glucocorticoids, what do they activate? They activate phosphoenol pyruvate carboxykinase, which catalyzes oxaloacetate to phosphoenol pyruvate in gluconeogenesis is what you need to remember. A 4-year-old has fever, diarrhea, blood culture grows a gram-negative rod. So Listeria is a gram-positive bacteria, right? So what is the most likely organism? Group B, Streptococcus. Streptococcus means gram-positive. Listeria is gram-positive. Salmonella gram-positive. Salmonella is the gram-negative. So that is the reason it is more likely to be gram-negative rod causing diarrhea can be Salmonella is what you need to remember. Shigella also is a gram-negative rod which can lead to the diarrhea, but it is less common than Salmonella is what you should remember. 3-year-old with bacterial meningitis, CSF fluid grows, gram-positive cocaine, short chains and diplococaine. What is it? It is Group B Streptococcus. Group B Streptococcus. Staph aureus is a gram-positive cocaine in clusters, not in chains or diplococaine. That's the point you need to appreciate. An outbreak of staphylococcal infection involving umbilical cord of 7 newborn babies is reported. So it is a bacteriophage typing which is used to determine the strain of Staphylococcus aureus and link the outbreak strain to the carriers is what you need to remember. So once more, doctor, all these funda, Streptococcus, Staphylococcus, without that there is no NEETPG exam. 27-year-old presents to the family doctor complaining being tired all the time. He recently returned from a fun-loving vacation and went to some infamous nightlife. There's a macular rash on the trunk and palms and the hand. No ulcers on the penis. Still, you consider secondary syphilis with characteristic rash, which can be Treponema pallidum, is what you need to remember. Cholera enterotoxin. It basically produces its effect by stimulating adenylyl cyclase activity in the mucosal cells is what you need to remember. Now, adenoviral infection. How do you describe adenovirus? Non-enveloped, double-stranded DNA virus with fibers at its vertices. Right? And once more, you should know different types of viruses. What is their structure? What are the DNA viruses, RNA viruses, naked viruses, coated viruses? Everything you need to be good with, doctor. So NEETPG sometimes becomes more or less like a Rattamaro. Some amount of Battimaro, Rattamaro is inevitable, but still you must be ready. So, doctor, 8-year-old boy, classic childhood illness, primary viral infection, which condition produce symptomatic disease? Epstein-Barr virus is common symptomatic infection in children presenting with infectious mononucleosis is what you need to remember. So what is the heterophile antibody? It is formed that agglutinates the sheep or horse red blood cells. The heterophile antibody test, otherwise called monospot test, is typically the feature which you see whenever you are suspecting the cause. EBV as a marker, EBV as a cause of infectious mononucleosis. So, doctor, with this we reach the end of the today's wonderful discussion. रोज पढ़ना है, रोज क्वेश्चन पेपर सॉल्व करना है, and every day we should improve. Hardly there are 1100 topics, not more than that. 10 to 20 points about each of them. More than enough for you to become the winner. Only you need to practice them in various MCQ scenarios. Get a good practice. Go to the exam with full confidence. Expect it and attack it. Expect, where is my TB question? Where is my apoptosis question? Where is my endometrial carcinoma question? Where is my cervical cancer question? Like that. You need to attack like a American Scud missile. Not you should be afraid, oh my God, I don't want ECG question. ECG question आ गया बोल के डरना नहीं. ECG question कहाँ है बोल के देखना. वहाँ SVT है या VT है या atrial fibrillation, or is it hyperkalemia, hypokalemia, hypercalcemia, hypocalcemia? What is the question? You need to make a diagnosis. After all, the number of questions examiner can imagine to ask you are very limited, doctor. Only you need to know how to play with these permutations. That's all. Every day with you, your classmate, roommate, benchmate, tablemate, Dr. Murali Bharadwaj, until you get the seat in the top rank in NEETPG. Good night.